Hey everyone, today I'll make you learn about the frozen shoulder. We all have senior citizens sitting at their home. They are suffering from some kind of pain and stiffness in their shoulders. 70% of them it is actually attributed to the frozen shoulder. Let's look what it is. See, what happens in frozen shoulder, there is a functional loss of the active as well as the passive range of motion. This active and passive range of motion involvement is actually symmetrical in nature, and we do not know the primary cause of the frozen shoulder, so it is idiopathic in nature. But we do know the secondary cause of the frozen shoulder and its associated conditions, like it occurs after trauma, proximal humerus fracture, after surgery, like rotator cuff repair, and associated conditions. It includes the diabetes, thyroid disorder, cardiovascular diseases, and the diptyrans contracture. These are the diseases. It occurs in the age group of the 40 to 60, and it is common in the women's. And it is mostly the non-dominant arm which is involved in case of frozen shoulder. We do not know the nature. We do not know the cause, the primary cause, but we do know how the process of the frozen shoulder, the pathophysiology of the frozen shoulder. What is happening is inflammatory process is occurring in the joint capsule or the capsuloligamental structure of the shoulder. This capsuloligamental structure, the ligaments includes are the superior glenohumeral ligament, middle glenohumeral ligament, and the inferior glenohumeral ligament. Now, in this capsuloligamental structure, there occur the fibroblastic proliferations. Because of that proliferation, the joint capsule it will become thick, sticky, and fibrous. Because of that thickening, what will happen? It will fall on itself. Because of that falling, what will happen? It is sticky there. It will unfold on itself. It will adhere to its surrounding structure and on itself also. Plus, it also adhere to the human head as well. So what will happen? This ultimately will create a mechanical lock to the motion of the shoulder joint. So that is what is happening. So in this stage, we can see at the inflammatory process level, there was occurring pain. And when there occur capsule thickening, adhesion, and infolding occur, there will be the range of motion will be restricted. So it is a stage disease, frozen shoulder. And in case of frozen shoulder, we can see the two images over here, in which one we can see the normal shoulder, another one we can see the red inflammation, and we can see the joint cavity is reduced, it is shrunken down. So this is the frozen shoulder. Regarding the capsuloligamental structure, it is mainly the coracohumeral ligament which is involved, and the capsule at the level of rotator cuff interval it is involved. See, the rotator cuff interval, it is a very important area and case of a shoulder joint. Now, look at the image. In this image, we can see the various ligaments and the capsule. In the ligaments, we can see it is the coracohumeral superior glenohumeral ligament, middle and the inferior glenohumeral ligament, and which has two part, anterior as well as the posterior part. This is the capsuloligament structure. Now, next is let's look at the rotator cuff interval boundary. Rotator cuff interval. In this image, we can see the triangular structure. We can see the greenish tinge ligament. This ligament is actually the coracohumeral ligament. It is one of the component of the content of the rotator cuff interval. So, rotator cuff interval, it is a triangular region between the anterior border of supraspinatus and the superior border of subscapularis. And one more thing, biceps tendon is also a part of this rotator cuff interval. Just remember that also. So regarding the content of the rotator cuff interval, it includes the coracohumeral ligament, biceps, and the superior glenohumeral ligament as well. These are the content of rotator interval. Now regarding the clinical scenarios, this patient suffer from the pain, stiffness, we know that. But actually, they follow a particular pattern in their appearance. When this patient comes to our OPD, in the initial phase, they comes with the only complaint of pain. That the stage of the pain is known as freezing phase, and that stage actually lasts for the 6 weeks to the 9 months. And next, slowly the pain will decreases and the stiffness will increases, and the range of motion is decreased up to that extent it can affect the daily day-to-day activities. And this stage 2 is known as frozen stage, and it lasts for the 4 to 9 months. And the last stage is the thawing stage. In this stage, there is a gradual return of the motion, not sudden return of the motion, gradually the day-to-day activities will be improved in these conditions. Now, one more important thing I want to talk about, which we have observed in examination of these frozen shoulder patients, that the most common affected movement of the shoulder in case of this frozen shoulder, it is the external rotation. It is the most commonly involved movement. That is external rotation. Now, regarding the diagnosis is made by exclusion because we do not have any primary cause, so diagnosis is made by exclusion. And regarding the investigation, by means of X-ray, we can just tell a difference between the osteoarthritis uh, from the frozen shoulder, and we can find out finding of like osteopenia, that is because of disuse. The main thing about the investigation is that look at the MRI over here. This is a normal MRI and this is the affected MRI. We can see that axillary pouch is missing in the affected MRI. So that's a peculiar finding. And regarding the treatment, how to bust frozen shoulder, which we can do by means of physiotherapy, NSAIDs, and steroid. This is basically a non-operative management. And if this therapy fails, then we have the options for mobilized under GA. And we have to follow this non-operative therapy actually for the 3 to 6 months. After that, we go for the mobilization under general anesthesia. And regarding the mobilization under general anesthesia, we have to take care in patients like diabetes, in case of thyroid, in case of cardiovascular diseases, and having the parents disease. Because in this patient, we actually have to explain them then that there's a 50% chance of failure of this MUGA therapy. 50% cases, this therapy will fail. With time, the stiffness will again come. And one more thing I want to say here that like regarding the physiotherapy, NSAIDs, and the steroid injections, we have to follow all the three up to the 6 months. Only after that, we will go to the next therapy like MUGA. And this MUGA actually is contraindicated in case of the freezing phase of the frozen shoulder, and it is contraindicated in case of rotator cuff diseases or like rotator cuff tear or labral tear. When this whole MUGA also fails, and the whole therapy has been non-conservative therapy has been failed, then we have the option of arthroscopic repair, arthroscopic release, and the open capsular release. And in all the two releases, actually we go for the subcapsular adhesion releases and the intracapsular adhesion and the subacromial adhesion release. And arthroscopically, if you look at the frozen shoulder, there are actually 4 stages of the frozen shoulder. Stage 1, it is the first stage, it's a stage of inflammation, where there occur the fibrinous synovitis. In stage 2, where there occur capsular contraction with the fibrinous adhesions. And the stage 3, where there occur increasing contraction and the synovitis resolving. And the stage 4, there occur severe contractions. Now, regarding the arthroscopic release, we actually focus on the rotator interval and its structure, mainly for ecofemoral ligament and the capsule lying over there. Plus, regarding the capsule, the posterior aspect of the capsule is also important for the release, because after releasing the posterior aspect, the internal rotation at the shoulder joint will increase and the cross body adduction movement also will increase. That is very important for the normal day-to-day life activities. Regarding the complications of the frozen shoulder, residual stiffness is there, axillary nerve injury after the capsular release, and the last one is the proximal humerus fracture in case of very stiff shoulder. Thank you.